health and social measures that have proven so effective against this virus. And as people move more easily, at the same time, our region has yet to access. So far, just 16.6% of the population of Latin America and the Caribbean has been fully vaccinated against COVID-19. Countries like the United States, Chile, and Uruguay, it remains below 20% for more than half of the countries. As countries have dedicated resources, staff, and attention to their COVID-19 responses, many have been hard pressed to keep up other essential health services that people need. In a recent survey of health services in the region, 97% of participating countries and territories reported disruptions. 45% reported disruptions in at least half of their health services. These disruptions are having an inordinate impact on our first level of care. The first level of care is the foundation of our health systems. Immunizations, where expectant mothers receive prenatal checkups, and where people living with chronic conditions receive their medications. It is also here where the most COVID-19 testing and contact tracing takes place. Disruptions at the first level of care have worsened over the course of this pandemic, and the consequences have been devastating, particularly for routine immunizations. More than 300,000 children, mostly in Brazil and Mexico, missed out on their routine immunizations last year, leaving them vulnerable to deadly yet preventable infections. We are seeing as well dangerous drops in measles vaccinations throughout our region. Coverage of the first dose of measles vaccines dropped by 10% in 8 countries in the Americas, including Venezuela, Panama, and Brazil, and dropped by as much as 20% in Suriname. If we do not reverse these trends, we risk an avalanche of worsening health issues in the Americas. Soon, COVID-19 will not be the only health crisis demanding countries' attention. We therefore urge countries to ensure their COVID-19 responses do not leave other essential services, health services like routine immunizations behind. These services are not optional, so countries must maintain them as they control COVID-19 outbreaks. Paho has worked with governments across our region to help them adjust and rethink how essential care is delivered at the first level, and we are continuing to work daily with them. Many health systems, including in Chile and Peru, have embraced telemedicine, and others have launched community outreach programs so patients can continue to be seen by providers from the comfort of their homes. As the demands on our health systems grow, countries must hire and train additional staff and ensure that every health worker has the tools and resources to safely offer care during a pandemic. Equally important is ensuring that healthcare workers are fairly compensated for their extraordinary efforts. Chile, for example, recently approved a pay bump to providers who have been so critical to the COVID-19 response. We know that the economic blowback of this pandemic is forcing countries to make difficult choices on where to prioritize spending. But we cannot afford to cut corners on health. Because make no mistake, sooner or later, countries will assume the costs. And that is why investing in the first level of care now is a smart choice, so we can reverse trends that are more efficiently and equitably than if we wait for health crises to surface. adage goes,